Hello, High Prevent listeners. Thank you for being here with us. Today, we are going to talk about Medicaid because the month of April is Medicaid Awareness Month. See, health is vital to everyone because good health allows us to function to our maximum capacity. But often, maintaining that healthy state comes at a price. What do you think happens when the cost of care becomes an obstacle to those seeking health care? Fortunately, in the US, we have programs that allows us to reduce the cost of care for eligible citizens. One of them is Medicaid. Celebrating this Medicaid Awareness Month is a good reminder that healthcare is a human right that must be protected by the government. So, what is Medicaid? Medicaid is a state and federal program that provides health coverage if you have a very low income or if you have a disability. Medicaid Title 19 was signed into law on July 30, 1965, in tandem with her sister program, Medicare Title 18, as part of the Social Security Act during President Lyndon Johnson administration. Before Medicaid was enacted, limited federal payments were made to states for healthcare services they purchased on behalf of public assistance recipients. Low-income Americans had limited access to healthcare, relying heavily on charity care and public hospitals. Medicaid was created with the intent to expand on existing federal support for healthcare services for recipients of aid to low-income individuals and families with dependent children. Under the original 1965 Medicaid law, medical eligibility was tied to cash assistance, either aid to families with dependent children or federal supplemental security income starting in 1972 for parents, children, and the poor, aged, blind, and people with disabilities. The past 4 decades have seen obviously many changes in federal Medicaid law, including significant modifications in eligibility, benefits, payment arrangements, and other administrative details. Did you know that Medicaid coverage differs from one state to another? Indeed, despite being a federal program, nowadays, states can decide who gets covered and what gets covered with Medicaid. Still, there are specific groups of people that are required by the federal government to receive coverage regardless of the state. Except that, for everyone else not specified by the federal government, the state gets to decide who qualifies. The Medicaid program is jointly funded by the federal government and states. The federal government pays states for a specified percentage of program expenditure called the Federal Medical Assistance Percentage.
In the US right now, there are approximately 1 in 5 Americans who are covered by Medicaid. This means that almost 65.7 million Americans get their health coverage from Medicaid. So, who's eligible to get health coverage from Medicaid? Well, Medicaid, like we mentioned, is a joint federal-state partnership program, which means that the national government and the individual state governments work together to decide Medicaid rules in each state. But in all states, certain low-income individuals are eligible for Medicaid. These individuals include 1. Low-income children who fall under CHIP, the Children's Health Insurance Program. 2. Low-income pregnant women. 3. Low-income parents of a child that is 18 years old or younger. 4. Low-income individuals with a qualifying disability or someone living with a person with a disability. And 5. Low-income individuals who are 65 plus. Although these qualifications are limited, many states, including Louisiana, decided to expand who qualifies for Medicaid after the government passed the Affordable Care Act. So let's talk about who is eligible now in Louisiana. The way that eligibility is determined in Louisiana and most other states is by using a metric called the federal poverty level. The federal poverty level, or FPL, is defined by the government and is used to determine whether an individual is living in poverty. This metric also takes into account the number of individuals that are living in a household. To determine FPL, you must know your yearly income, or the amount of money that you make in a year. For a one-person household, the FPL is defined as $12,880 in income per year. This number increases as the household gets bigger. In Louisiana, if you are at or below 138% of the federal poverty level, you officially qualify for Medicaid. But what does 138% of the federal poverty level mean? It means with a household income at, below, or up to 1.38 times the federal poverty level. For an individual, this number is $17,774. I know this all sounds very complicated, and it kind of is, but what you really need to know to figure out if you qualify for Medicaid health coverage is how much money you make in a year. There are resources online that can tell you whether this income allows you free or low-cost health insurance through Medicaid. In addition to being a low-income household, there are other things that can qualify you for Medicaid in Louisiana. Those things are, if you have a qualifying disability, this is determined by the Social Security Administration, but includes mostly people whose disability limits how much they can work. Other groups that qualify are children under the age of 19, pregnant persons, those being treated for cervical or breast cancer and have no insurance, and individuals who are considered legally blind. If you meet one of these criteria, you do not need to meet any income level. You automatically qualify for Medicaid coverage in Louisiana. The type and level of coverage varies situation to situation. The most recent Medicaid updates occurred on March 13, 2021, when President Biden signed the American Rescue Plan. The goal of this plan is to expand even more who can be covered, lower the costs of coverage, and reduce any racial disparities or differences in healthcare. So, what does it mean for Louisianians? Well, first of all, it makes it so a person has the option to purchase Medicaid health insurance that has a premium that is less than 8.5% of their yearly income. A premium is the amount of money a person pays per month to Medicaid to be covered and have health insurance. It gets rid of premiums for anyone getting unemployment in 2021 and individuals who earn $19,000 or less per year. It makes health coverage more affordable for middle-class families and individuals who do not qualify for Medicaid by covering part of their premium. Although this was already the case, the American Rescue Plan expanded who can benefit from this. Although these may seem like small changes, they can have a big impact on some families.
Why is Medicaid important? Medicaid is important because it provides access to healthcare for low-income individuals and families. It saves lives. Let's take a closer look. There are many people who avoid getting general checkups or prolong necessary hospital or clinic visits even if they need medical attention. This avoidance may be due to high costs typically associated with healthcare, especially if someone has no insurance. According to the American Cancer Society's Cancer Action Network, infant mortality rates in Medicaid expansion states have decreased, while rates have increased in non-Medicaid expansion states. From 2014 to 2017, the Medicaid expansion program saved the lives of over 19,000 people aged 55 to 64. Medicaid plays an important role in addressing the opioid epidemic and accessing behavioral health services. Lastly, Medicaid expansion is associated with a lower poverty rate, with 690,000 less individuals living in poverty. How do I enroll for Medicaid coverage? Well, you can enroll for Medicaid coverage on your own or with help at an application center, which could be in a hospital or a clinic, including Odyssey House, Louisiana. Our clinic address is 2700 South Broad Street, New Orleans, Louisiana 70125. If you want to enroll on your own and are a Louisiana resident, you need to go to the Louisiana Department of Health website, ldh.la.gov, click Medicaid, and apply for Medicaid. You need to create an account, fill in your information, and start, complete, and submit an application. It may be easier to apply in person at an application center because a certified agent will be able to fill out the information for you in the correct places. Again, application centers in the New Orleans area include hospitals and clinics, including OHL. Call us at 504-418-4955 if you need help applying for Medicaid. You can also apply over the phone toll-free by calling 1-888-342-6207. Links to get to the application site for Louisiana residents and for a directory of places you can go to apply in person will be in the description below. That marks the end of our video. Thank you, iPrevent viewers, for joining us today to learn more about Medicaid during Medicaid Awareness Month. Everybody deserves healthcare, and lack of insurance should not be a barrier to accessing healthcare. If you or someone you know needs health insurance, please apply for Medicaid in order to get access to health services. As always, call us at 504-418-4955 for free condoms and lube, free HIV or Hep C testing, to set up a clinic appointment, or if you would like to enroll in Medicaid. Until next time.